New data from the state of Texas shows a huge increase in positive tests, reaching another pandemic high. The current positivity rate in Texas is 22.3%. 2 weeks ago, that number was 9.19%. Nearly 1 out of 4 people tested for COVID is positive. And as we have seen from the long lines at testing sites, a lot more people are getting tested, especially around the holidays. Meanwhile, there is a limited supply of antibody therapy to help keep people out of hospitals because the most popular option is not effective against Omicron. Fox 4's Lynn Wynn spoke to people who are searching tonight for help. Lynn.
Heather, many people we talked to say they've contacted several infusion centers that have either run out of monoclonal antibodies or are not taking new patients in.
I was very frightened. And my husband, I could tell by the look on his face that he was concerned too, just because of how rapidly it was taking over.
Ann McSwain tested positive for COVID-19 last week, and very quickly her symptoms got worse. She, along with her husband, who also tested positive, tried contacting several different facilities looking for monoclonal antibodies, with no luck.
There's one in Fort Worth, and I want to say one in Rockwall. Both of those were out. Then she referred my husband and I to Baylor Grapevine to see if they had any connections, and they were out as well.
Like the McSwains, Jamie Wilder spent hours on the phone looking for the treatment for her 74-year-old mother, who, along with Wilder herself, recently tested positive for COVID-19.
They're like, we're completely out. We don't know when we're getting more. So there were several places. I think I probably called 10 places.
Both families were eventually able to find treatment in Ferris. McSwain says she started feeling better within 12 hours and was lucky she didn't have to wait longer for an appointment.
I think I would probably be in a hospital by now. There was no way, as rapidly as it was taking over, that I don't see any other route.
But like so many others across the Metroplex, the infusion center in Ferris has also run out of the treatment this week, turning dozens of people away every day.
We have over 160 people a day that are needing to be treated, and we simply don't have the doses anymore.
Last week, the Department of Health and Human Services announced a pause in shipments of monoclonal antibodies like Regeneron, which have been shown to be less effective against the Omicron variant.
Regeneron, while it was about 80 to 90% effective against the Delta variant, is only about 30 to 40% effective against Omicron. However, I'd rather have a 30 to 40% chance of helping somebody than a 0% chance.
A different treatment called sotrovimab is more effective against Omicron, but the supply isn't there. The state health department says due to a national shortage, regional infusion centers in several cities, including Fort Worth, Austin, and El Paso, have run out of it, leaving families desperately looking for treatment options to prevent more severe illness and hospitalization. And we're told about 300,000 doses of sotrovimab are due to be shipped out in January. Heather?
All right, Lynn, thank you.